Hi, this is Dr. Yunhan Kim. I'm an integrative functional medicine physician and I'm an expert at LDN therapy. I was introduced to LDN by a patient. The patient said, I have Hashimoto's thyroiditis. This doesn't look like a lot of things that will treat the root cause. Would you consider doing research and prescribe LDN? I did the research. It wasn't convincing, but what was convincing is not a lot of side effects. So I tried it on that person, and that person became free of Hashimoto's disease. So I got very interested, more reading, and I eventually wrote two books and an article and many lectures through LDN Research Trust I have contributed. So today I want to talk about LDN and fibromyalgia. I think fibromyalgia, when I first trained, the people used to ask me, physicians who used to ask me, do you believe in fibromyalgia? I don't think I've encountered that kind of question recently, but I think that the term fibromyalgia may be used as like a bucket for people with uncontrolled pain. What I can share with you is that if you have uncontrolled pain for a long time, your brain will develop sensitization similar to fibromyalgia. And then there are people with fibromyalgia meeting the classical definition that there is no evidence of inflammation. They shouldn't have this fibromyalgia pain, but they do. And then there are other people, they have a little bit of inflammation. The research on LDN and fibromyalgia, some of the best research that was done was Dr. Younger, at that time Stanford, and he concluded that people who had inflammation, even a little bit of inflammation, they got better results for um, treating fibromyalgia with LDN than other people. So from there, a lot of us got idea that LDN may be a new type of unique anti-inflammatory agent. So that seems to be true. It's an anti-inflammatory agent. It calms the immune system. It calms the nervous system, and it's excellent tool to treat neuropathy. Neuropathy is pain where you feel tingling, burning, ice, compression as the pain moves forward. Other uses of LDN for chronic pain include um, sympathetic dystrophy, which now is called complex regional pain syndrome. The fibromyalgia bit, I go back to it, and the diagnosis, they do have criteria on that, but I'm not convinced we really know what fibromyalgia is. Like I said, there are many pathways to fibromyalgia. If you have had pain that is uncontrolled, that is surgical pain, whatever pain, I think that you do get fibromyalgia like syndrome where you get central sensitization to pain will occur. Other people, classic definition of fibromyalgia, they hurt, but there is no evidence that we can objectively say why they should have pain. Other people have pain and then they have inflammation. So LDN, in my opinion, works best for that. Another thing is that LDN works really well if there is a neurological basis of that pain, if there is a basis of pain that is autoimmune related. So, um, so I think treating people with fibromyalgia with LDN is a reasonable thing to do. I think it's a great thing to do. But you have to understand that many of these people would be endorphin deficient. The reason is that they're using their endorphin to fight pain, so there's not any left over. And then if you give these people standard dose, they're gonna have side effects. They're gonna have terrible side effects. So what I recommend is that if you're using LDN for wellness, that's one thing. If you're using LDN for specific medical purposes, you should probably work with someone who knows LDN forwards and backwards. I was told that don't be a physician that knows a little bit about a lot of medications. Be a physician that uses a few medications and you as much as you can about those topics. This is Dr. Kim. If you found this useful, interesting, or you learned something, please share with another person. Like the video, subscribe to the channel, and ring the bell. And that way you'll be notified when I record 2 times a week. Thank you.